Now we begin our discussion on gallbladder, where we will be starting with the surgical anatomy. So let's go make a schematic representation of the gallbladder. This being a gallbladder, right? This coming the cystic duct. From here comes your common hepatic duct, which joins to form your common bile duct. This could be the common hepatic duct, and this is your cystic duct. So this gallbladder is situated on the undersurface of liver. It is a pear-shaped organ. This size varies from 7.5 to 12 centimeter. Its capacity is 25 to 30 ml. It consists of a fundus, which is this part. Then it consists of a body, and then it consists of a neck. So this part would be your fundus. This part would be your body part, and the neck would be somewhere over here, right? So the gallbladder consists of a fundus, body, and neck, and there is an outpouching near the neck, which is also called the Hartmann's pouch. So the mucous membrane of the gallbladder have small opening which are called crypts of Luschka. CBD is a 7.5 centimeter long structure, consists of supraduodenal part, which is around 2.5 centimeter long, consists of retroduodenal part, consists of infraduodenal part, and it consists of intraduodenal part. This intraduodenal part is surrounded by sphincter of Oddi. Right now, the cystic duct is around 3 centimeter long, the diameter of which is 1 to 3 mm. Now, the mucosa of cystic duct consists of spiral fold, which is valve of Hester, and surrounded by sphincter of Lutken. Right? So the blood supply over here is by cystic artery, which is a branch of right hepatic artery. Now, in some cases, there might be accessory cystic artery, which is not the branch of the right hepatic artery, rather, it is the branch of gastroduodenal artery. Then the lymph node or the sentinel lymph node of the gallbladder is the lymph node of LUND. Right now, there's an important triangle which we refer to as the Calitz triangle. This image has been taken from the internet resources. Now, this is bounded by the cystic duct, the inferior surface of the liver, and medially by the common hepatic duct. The importance of this triangle is that lies in it is the cystic artery. So this is an important landmark in your operative procedure of lap cholecystectomy. Now, in surgeries of gallbladder, what is mainly notorious is the variation of the blood supply. There are innumerable number of variations that are encountered in your surgical practice. There might be a short cystic duct or a long cystic duct, which makes it very difficult to actually visualize or understand what exactly is the structure, and as a result of which a lot of complications do occur by novice surgeons in lap cholecystectomy. So here is one of the examples of what are the variations that can be seen. This image has been taken from Bailey and Love 27th edition. So over here we are seeing about the caterpillar hump and the Moynihan's hump. Now if you see the first image, that is which is labeled as A, you find that it is the usual anatomy of the calots triangle over here. However, in case of B, you can see a tortuous right hepatic artery taking a short cystic artery. And in case of C, you can see that there's a tortuous hepatic artery with a short cystic artery. Now, these are so-called the caterpillar turn or the Moynihan hump, which, if not recognized, as mentioned earlier, it would lead to torrential bleeding and it would be difficult to control. Now, one very important, or not important, and interesting topic is regarding the Phrygian cap. Now, this is seen in some of the cases, basically, usually around 5% of the cases. Now, the images have been taken from the internet. Now, this gallbladder resembles the hat worn by the people of Phrygia. Gallbladder resembles hat worn by people of Phrygia. Usually do not need to do anything as such. This has been asked in one of the recent exams regarding the Phrygian cap, hence I have put it over here. So in the anatomy of the gallbladder, the important points that you need to remember is regarding the CBD, sorry for this, regarding the CBD, which is the 7.5 centimeter long, and the intraduodenal part consists the sphincter of Oddi. In case of gallbladder, crypts of Luschka, then valve of Henster and sphincter of Lutkin in case of cystic duct. Right? The accessory cystic artery is supplied by the branch of gastroduodenal artery, and the lymph node of Lund in the sentinel lymph node in case of gallbladder. Calot triangle or cystohepatic triangle is a very important landmark because to identify the cystic artery. Then the caterpillar or Moynihan's hump. This can be given to you as an image and asked to identify the pathology. And an extra point which has been asked in one of the recent exams regarding the Phrygian cap. Basically, we just need to do nothing as such because it would not be causing any symptoms in the patient. Thank you.